Hi, thank you again for joining us tonight. And again, as we are starting our evening sessions off with fostering emotional and mental health for support through psychosocial well-being of siblings. And this is a really important topic for me. My daughter that brought me into this community is my oldest. She's 22 now, and she has two younger siblings. And I often think about how our family is affected and how they personally get affected by their siblings. So I am just really excited. Thank you guys so much for being here tonight. I'm really excited for this panel, for this presentation. I am one of two of your facilitators tonight, and so I'm going to announce when we have about 20 minutes left before the session is complete. And then the presenters will have about 10 minutes to wrap up, and we'll move on to just a couple additional conference business items like prizes and the session evaluation. And so again, I'm Colleen Kenny, and I have been, I'm proud to have been part of the planning committee for this conference. And I work at the Utah Parent Center on the Utah Family Voices Project. If you have any questions, you can put them into the chat and we will help field those tonight. Our other facilitator is Lisa Thornton. I'll let her introduce herself and our presenters tonight.
So I'm Lisa Thornton, as Colleen said, and I serve on the Family Links Council, and I'm also lucky enough to be the mom to two of the presenters today. So as way of introduction, Dr. Lara Bennett Murphy earned her doctorate in clinical psychology from Duke University. She completed a residency and a postdoctoral fellowship at Nationwide Children's Hospital in Columbus, Ohio. Dr. Murphy currently is an associate clinical professor of pediatrics at the University of Utah School of Medicine and Primary Children's Hospital. She works with infants, children, adolescents, young adults, and their families who live with chronic illness and psychological distress. Specialties include medical trauma, eating disorders in medically complex children, coping with chronic pain, refugee health and mental health, and siblings of children with chronic medical conditions. She truly is the best psychologist we know. Emma Thornton is an undergraduate student at Utah State University working toward medical school. When Emma was 4 years old, her youngest sister, Kate, was diagnosed with PotterWillie syndrome. Growing up with Kate, Emma had the opportunity to contribute and learn from the PotterWillie and other developmental disorder communities. She has been a contributing member of research with such mentors as Dr. Lara Bennett Murphy and has worked to help support people connected to and individuals with developmental disabilities. Emma is one of the co-founders of a support group for siblings of individuals with Prader-Willi syndrome and has also presented on her sibling research at a state and national level. Jane Thornton, who's the youngest of the two, is a student at Utah State University, finishing up her bachelor's degree in social work and will begin her master's degree in social work in the summer. Her little sister, Kate, has Prader-Willi syndrome, and because of that relationship, Jane is very passionate about helping families with individuals with disabilities. In 2017, she helped found and now runs a support group for individuals, siblings of individuals with Prader-Willi syndrome. In conjunction with Dr. Lara Bennett Murphy at the University of Utah, she has conducted extensive research on sibling issues and has published 10 articles on the subject. She has also presented on sibling-related issues at a state and national level. And I am so proud of these girls. So take it away.
Thank you. Thank you for that beautiful introduction. Can we get the Thornton screen share option now? So we were really fortunate to be awarded a grant from, thank you. We can go down a couple. Can I control it or no? So to be awarded a grant, we can go maybe page down. To conduct this study, we're not promoting any products. We don't have any financial interest to disclose. Slide. But we are deeply, deeply grateful to those who have supported us. So we're hoping to talk about actually a couple of different things about how how siblings of children with disabilities may be affected, and then how we can help support healthy siblings, parents, the entire family unit of those affected.
Sorry, we got it.
No worries, no worries. So next slide, please. Our work was with PotterWillie, with families affected by that. Again, I work in the PotterWillie clinic, and both Jane and Emma have a sister with PotterWillie. But as we began presenting our data to physicians and to parents and in different settings, we kept hearing like, "Wait, this really seems to fit my family. I have a child with autism," or "This really seems to fit my family. I have a child with, Down syndrome and some psychiatric concerns." Or so we wanted to share the results. We'll talk particularly about the Prader-Willi population, but also um, hoping that we're touching on kind of many people's different experiences about how their family maybe has been affected. Okay, slide. Next. So we based our model on Yuri Bronfenbrenner. He's a sociologist from Chicago, again, older than I am. So, his work's been around for a long time. And the idea is that individuals, the children, are embedded in communities, and those closest to them have the greatest impact, but all levels of society affect how that child develops, and then that child affects other people in their system. And typically, what the literature talks about is like the child with a disability. So, how that affects how that child is affected by their teachers and by their parents and by their schools. And most of the advice and literature out there is really how we can get these systems that are in place to support the child with a disability. So, we shifted it a little bit in slide by putting the healthy sibling in the middle and saying, let's think about the healthy sibling's ecology and how growing up with a sibling with a disability and parents who are caring for a child with special needs, how does that affect their interaction with the medical system, with their school, etc. So we've kind of tried to shift it because we would hear stories about, for example, the healthy sibling being pulled out of a class to go down to the classroom for the children with special needs because their sibling was having a tantrum. And so it was a different school experience. And so we really tried to think about the myriad ways in which these healthy siblings, the systems they were embedded in, were affected and affecting them. So there aren't many data out there, particularly with respect to Prader-Willi. So we went to a couple other literatures. We started with the chronic illness literature, which is probably nearest to my specialty and my heart. And we know that, and most of this data, by the way, is collected on healthy siblings of kids who have cancer, cystic fibrosis, diabetes. Those are the three most studied groups. And if you look at kind of a meta-analysis across reviewed studies, siblings of children with chronic illness have higher rates of depression and anxiety than their peers who have healthy siblings. Their peer activities like sports and music and those kinds of things are lower, and their cognitive development scores are lower. The illnesses that affect daily living, so meals, getting to school on time, those kinds of things, the regimens that affect daily living have the most negative impact. But they're modified by lots of factors. And so that's very, very important to know that it's not a one-to-one correlation. So really thinking about, well, what are the factors that are protective and what are the factors that put kids at risk is really important. Parents and siblings are often more vulnerable to things like post-traumatic stress syndrome than the affected child. So in looking at like families with cancer, 41% of mothers and 30% of fathers have clinically significant symptoms of post-traumatic stress. And siblings of chronically ill children also are at high risk, right? With 60% of siblings scoring in a moderate range of having post-traumatic stress symptoms and 22% meaningful criteria for post-traumatic stress. And usually when we talk about traumatic stress, we think about things like wars and earthquakes and fires and school shootings. But what makes, I think, families, parents, and healthy siblings is that you're often quite helpless watching someone you love be in a very scary or dangerous situation and feeling unable to help them as you watch their challenges in both traumatic ways and in daily ways. Okay, slide. In the developmental disabilities literature, and most of this literature really focuses on trisomy 21, but there was a study done in the United Kingdom that found 14% of older siblings of children with intellectual disability had adjustment problems. And that's about 1.5 times what you would expect in a population, in a general population. Um, so siblings of children with intellectual delays are at greater risk for psychological difficulties, social difficulties, and again, these things are modified by factors like the gender of the child, the age of the child, the parents, those kinds of things. Slide. And in autism, we see a similar finding that siblings of children with autism have psychological, behavioral, and social problems greater than their peers when everyone is healthy or typically developing. So in a study about a decade ago, Ross and Cuskley reported that about 40% of siblings of children with autism developed clinically significant psychological challenges, typically anxiety or depression. The more aggressive the child with autism spectrum disorder, the more the typical healthy siblings struggled. Even though siblings were able to separate, in their study, they did a really nice kind of analysis. Siblings could say, I understand it's the autism, not, the personhood of my sibling that wasn't protective, even recognizing when it was the illness, not the person. Slide. So in PotterWillie, children with PotterWillie often have these intense medical, especially early. They spend a lot of time in the hospital. A lot of early intervention services often struggle to feed and thrive. But also as they get older, you see more behavioral concerns, everything from food seeking to higher rates of anxiety and depression and psychiatric aggression, things like that in the child with Prader-Willi. So the healthy sibling is confronted with, multiple challenges in domains of life. Maybe mom and the sibling with the disability are in the hospital. And so they don't have access to mom for a little while. Or it's time to go on a trip that the child has a medical emergency or those kinds of things. So the needs and demands change over time, but the few studies that are out there for siblings of children with Prader-Willi suggest that that these siblings suffer, and they suffer into adulthood. It's not modified by parenting style or attachment, and this is one of the only times I've ever in my 25-year plus career seen this. Usually, if you have a secure attachment to parents, that's very, very protective and buffering. But in the couple studies that are out there, parents can be doing a fabulous job and kids can feel very safe with their parent and still suffer the consequences of growing up with a child who may have unpredictable behavior and unpredictable medical needs. Next slide. So this is the Prader-Willi studies that kind of instigated our study. This was Mazahari and colleagues looked at 13 healthy siblings of children with Prader-Willi, and they compared them to siblings of children who were in a hospital and then children who were outpatient but chronically ill. And they noted a dramatic decline in family quality of life. And so this is based on 100% is your life is ideal, no one's ever there. And so kind of what percent is like a perfect quality of life? Most families are in the mid 80s, let's say, if there are very few challenges for that family. For chronically ill kids, a number around 79 to 81% is typical. But in Prader-Willi, we see a very, very significantly impaired quality of life. And for the siblings, symptoms of PTSD were notably high, with 92% scoring in the moderate to severe range. Slide. So really what we were looking at the literature, and Jane and Emma and I were kind of starting these these sibling support groups, And in one of our first support groups, one of our participants was a 9-year-old little girl said, I feel like a piece of dust. And she was talking about how she's always there, but not really seen, and feeling very insignificant in her family, feeling like her siblings' needs always came first. And that so struck and, just right an arrow to the heart. It was so powerful that we said we need to understand this more. Okay, slide. Now, I am, of the three of us, I'm the negative Nelly. I try really hard to be positive, but I'm trained to find psychopathology and work with it. We do want to acknowledge that there is a small, even smaller than our already small literature, looking at positivity and resilience. So this is primarily done with siblings of children with autism, and found that um, healthy siblings report more admiration for their sibling. Oh, sorry, I'm on an automatic light system. They felt less competitive, less rivalry with their sibling, and there was less quarreling with their sibling with autism. And this was there was a qualitative study done 7 years later, and one of our favorite quotes from that was, "I like how he always shows who he is," right? That often we see in healthy siblings a valuing of the authenticity of their sibling, and just the innocent humanity, or kind of ever-present humanity. Okay, slide. So the experience of being a healthy sibling is complex. Our siblings are at risk for loneliness, anxiety, depression, feeling less intimacy with family members and peers, and lowered academic achievement. Again, I hear from kids all the time that my mom and dad are busy. I don't want to interrupt them, so I don't tell them what's going on. They have enough on their plate, or they have enough caring for my sibling, or my friends don't get it. I try to explain it. We hear this in PotterWillie all the time when healthy siblings say, like, are trying to describe hyperphagia, and that the child is always hungry and never satisfied. Kids will say, "Oh, I have that," and it's innocent and ignorant and playful, but it also, what it has the effect of doing is saying, "I don't really get your experience. I don't get how hard it is that you can't be around food without your sibling being in danger, and your sibling can be in danger." And so it can feel very lonely. And so healthy siblings just stop talking about it. They stop trying to explain it, because it often feels misunderstood. So it can be, again, less intimacy and more loneliness. But we hypothesized, based on the small literature that was out there, maybe youngsters develop more compassion and tolerance, and develop strengths also as a result of growing up in this particular environment. Okay, slide. This was another one of my favorite quotes. After we were just talking about the complexity, one kid just went, "Oh, it's a roller coaster ride. Like, we're up, we're down, it's a roller coaster ride." So out of our experiences, we decided to set out and study more systematically rather than anecdotally what was going on for families within our catchment area. We measured empirically in our healthy sibling participants. We had them fill out a questionnaire on resilience, on their emotional functioning. We looked at diagnoses for trauma. We had parents fill out questionnaires about family functioning. We had parents report on their own well-being, because, again, I know, like in my family, we joke, if mom goes down, the whole ship goes down, right? But how are the parents doing? How are they caring for themselves and everyone, all the siblings, marital satisfaction, things like that. And then just also recognizing that how well any individual or family system does is affected by things like, do you have access to support? Do you have access to services? Do you have access to DSPD funding? Do you have help at the school and a good IEP? If you don't have a good IEP, then things can be pretty tricky. So we wanted to really think about, this isn't like a question of individual strength or vulnerability. It's a question of what kinds of levels of systemic support are there. Okay, slide. So I am going to hand off to Jane and Emma, because I think they really brought the human lens to the study that we did.
All right, so as children, we're all in our own universe, and our experiences are our reality. But as Jane and I got older, we realized that how we grew up wasn't normal, and it wasn't similar to our peers, that living with a child with PotterWillie isn't normal. Our childhood was overshadowed by Prader-Willi syndrome. We weren't just Kate's older sisters, we were her caregivers. And by the time that we were old enough to be self-aware and realize that, we also came to the realization the effect that growing up with Kate had on our lives.
Yeah, and we realized that siblings need extra support because of those challenges. And so basically we thought, who better to support siblings than other siblings? So we, like was said, we started a support group and did this research, and we're here to share that with you today.
Yeah, so the research that we gathered was both quantitative and qualitative, and we used different survey methods and interviewing methods for our data collection.
Yeah, so for the parent survey, we used 3 measures: the family environmental scale, the youth outcome questionnaire, and the 14-item scale of general well-being. And then for the sibling surveys, the positive and negative affect scale for children, Connor-Davidson resilience, and the child report of post-traumatic stress symptoms.
And then for our interviews, they lasted about 30 minutes and consisted of 17 questions similar to the ones displayed before you. Like, do you have friends over at your house? What are some good things of having your sibling? Yeah. Okay.
So as Lara hinted at, there are so many emotions that come along with being a sibling to someone with disabilities. So a lot of our interviewed siblings made these types of comments, like, I'm grateful for what she adds to the family. It's impossible not to love her. So yeah, although disabilities bring a lot of intense negative emotions, they bring a lot of positive ones. So it's not all bad. And when us siblings get together in our groups, we share like endless laughs and just so much love that we have for our siblings.
We definitely see that these kids have a different way of seeing the world, and each time we even catch a glimpse through their eyes, all we recognize is goodness and purity.
Yeah, goodness. So these are quotes from siblings in our qualitative interviews. Like, you just want to be normal, but I love being a sibling, but I feel bad all the time. So yeah, there's so many emotions and they come in extremes. So living with someone with disabilities is hard. Like, explosions and even just daily hassles start to weigh on children, and usually they lack the emotional maturity and understanding to be able to cope well with their situation. So, and if these children don't have protective factors that enable resilience and kind of bouncing back after some of these hardships, it'll have serious consequences that will stay with them as adults. So for me, some of these consequences presented themselves when I was 15 and actually diagnosed with post-traumatic stress disorder from living with Kate. And so things were bad. I was like held up in my room. I suffered with a lot of anxiety and I couldn't even stand being around Kate. So I really didn't have the skills or support I needed to thrive in this challenging, although extremely rewarding environment. But that being said, not all siblings are affected the same way.
Mm-hmm. Just as Jane was describing, I too felt all of these extreme emotions living in the volatile environment of having Kate in our house. But they didn't present themselves as blatantly as Jane's did later on. I tended to bottle up my emotions instead of expressing them. And I'm still working now to uncover the buried emotions. Guilt is one that I have started addressing recently. I would feel a lot of guilt when I would leave my house to escape Kate, but leave that burden on others. And this is a phenomenon that we've come to understand with other siblings as well. A lot of siblings lack an outlet and it leads to a buildup of resentment. And that was the case for me. One of our siblings said, one of the siblings that we surveyed said, negative feelings come a lot, but I separate my sister and her disorder. I blame the PotterWillie and not her. I don't like the disability, but I love my sister. And we find that this sentiment is easy to say, but the distinction is not easily internalized for siblings. It's almost impossible for me to effectively attribute my feelings to Kate's syndrome and not to her herself, or just my family in general. So I kept a lot of that resentment and frustration inside because I didn't see the necessity of opening up, and I didn't have a structure around me to support and offer me. Oops, sorry. Okay. So yeah, so safety is definitely a pertinent consideration. Like these quotes say, like, I worry about my sister's safety. She doesn't have common sense. She might wander off. So kids with disabilities tend to get into trouble and don't have like the necessary capacities that keep them safe. So this can be really stressful for the rest of the family. And 80% of the interviewed siblings claim that they worried about their sibling safety often. And 40% often worried about the rest of the family's safety because of the sibling with disabilities. And many times the sibling's own safety is at risk. Like this statistic says 77% are often hurt by their sibling. I know we definitely have. Okay, so there are many valuable skills and attributes that siblings obtain early in life from having someone with PotterWillie.
Yeah, and we tend to find hope in looking forward toward possibilities of growth and healing, but also in looking back at the hardships that we've endured and the amazing experiences that we have had. And a common coping method for siblings is to share experiences and laugh, and humor is a large part of our coping process.
Okay. So yeah,
sorry, I interrupt 1 second because I saw a hand was raised, but I don't know what to do about that. Should we pause and take questions?
You guys want to, it's up to you guys if you want to field questions as we go, or I can ask Renee or I can ask them to put them in the chat and we can get them at the end.
So maybe let's let Jane and Emma finish the qualitative part and what they were hearing from siblings regarding the survey, and then we'll take, in their interviews when they were talking, and then we'll take a break, and then I can present the empirical, and then we can have questions at the end as well.
I love that. So ladies, if you had some questions, please put those into the chat and we can make sure to remind them in just 1 minute.
So it's definitely all worth it. We absolutely love being siblings. All right. So siblings' relationships with their family member with disabilities is quite complex. Yeah, as one sibling said, it's a love-hate relationship. And research shows that almost all siblings have an intense love for and endearing relationship with their sibling with disabilities. Many describe it as their most special and precious relationship. However, this relationship can also be incredibly painful, causing extreme stress, worry, embarrassment, and guilt. So one phenomenon discovered in our research was the emergence of 3 distinct roles taken on by many of the siblings. These are the ones we've discovered. There are probably many more. So the first was the nurturing sibling. So this is the preferred playmate and caregiver to the family member with disabilities. And the next is the triggering sibling, who often has a distant and volatile relationship with their family member with disabilities and often antagonizes and teases them. But it appears that as the triggering siblings, triggering siblings provoke their siblings into a meltdown so that their sibling has control over when the meltdown will happen. So it's a coping mechanism, though not a very healthy one, that gives them some control over their environment. So these triggering siblings also seem to be more sensitive to their environment, and they're more, so it's likely that they're more vulnerable to stressors and risks such as post-traumatic stress disorder. Many times these siblings feel incredibly guilty for distressing their family member with disabilities, but often can't stop this behavior.
And it's probable that if these triggering siblings learn a healthy coping mechanism and gain more control over their environment in other areas, that these triggering coping mechanisms will no longer be needed, and the siblings can start to build a healthy relationship with their family member with disabilities. So the third role, the absent siblings, are largely uninvolved in the family member with disabilities' lives. They tend to be considered older or they tend to be considerably older or younger than the family member with disabilities, or have personality traits like being very independent or reserves. So these siblings tend to go off and do their own thing and ignore their family member with disabilities. So for our family, Emma was the nurturing sibling who Kate absolutely adored and would want to do everything with. So Kate had a weekly ritual of rating her family members, of course, and Emma, always number one, always, and I was consistently number 9, right? In our family of 7, which is fun. So I was definitely the triggering sibling. I would provoke Kate and tease her mercilessly, and it's just, yeah, but I would do it so I knew when the explosion was going to happen. That was so powerful for me to understand because I had so much guilt. I'm like, I just felt like a horrible person, but I couldn't control it. I couldn't stop it. And so learning that this was like a coping mechanism, that was life-changing for me. And once I aged and went to therapy and started building skills and healing, I lost that triggering coping mechanism, and I can now happily report I am ranked 4th in our family of 7.
Yeah, and I like to make the qualification that however ideal the nurturing sibling role seems, being the favored one also comes with challenges. When I was living at home, I couldn't leave the house when Kate was near the door without inciting a huge tantrum of jealousy and questions and concerns of where I was going. I would continually have to sneak out and back in for mundane things such as soccer practice. And if she would catch me leaving, she would come running and screaming, and I would have to get in and lock the car door, and my mom would have to come and drag her back into the house. And she would consistently choose me to take her out of family gatherings and things like that when she was bored. So I would spend the evenings walking outside with her instead of actually participating in the experience. So being favored added an overwhelming responsibility to my childhood.
Yeah, back to you, Lara.
And so I think one of the observations that we talk about with parents and with families is that siblings react differently. There's no one family environment, and we're all different human beings. So we talk about some kids, some siblings, healthy siblings are like dandelions. They will thrive anywhere. You can try to squish them and they thrive. And then others are more like orchids, and they need some tender, loving care and more attention, and are beautiful and are amazing, and again, just require more to thrive, more tenderness, I think, to thrive. And so one of the things that we saw in our studies, again, in the qualitative study that Emma and Jane are describing, we saw these kids were reporting very strong emotions in all directions, and how much this affected them, and how much they worried about their family and other members of their family and themselves, and that could be both a stimulus for growth and also sometimes a challenge. So let's go ahead and take questions right now, and then I'll kind of briefly hit the quantitative data, and then we can talk at the end.
We actually didn't. Oh, here we go. Um, can we get some more information on the sibling support group?
Yes, and so that support group is right now specifically for siblings of children with PotterWillie. And I think we can at the end maybe share or put in the chat or something like how to reach out if your child is affected by Prader-Willi syndrome. I think it would be a great challenge for those of us who connect with the Utah Parent Center and value their services so much to help find and create sibling support groups that are either more heterogeneous or that address other conditions as well, like autism.
We will send a resource guide that does have some resources on other sibling support groups.
Absolutely. And yeah, even with Utah Family Voices, we would love to be able to share that with the Prader-Willi families that call in for help. So thank you guys. That was the only question that was written in.
Okay. Anybody else want to raise their hand or? Okay. So we were really particularly interested in traumatic responses, like if you've witnessed your sibling have a meltdown or attack your parent or attack you or run away or something like that in a moment of distress. And the only thing that predicted traumatic stress in our healthy siblings in our study with what we measured was the ratio of positive to negative emotions. So it wasn't just like, do they get anxious or are they depressed or do they feel anger? It really was how much positivity was there to balance out the negative. And so, and this was interesting because if you look at the marriage ratio, I mean, if you look at the marriage literature, if you look at families where the couple divorces compared to families where the couple stays together, they have the same number of fights, the same number of arguments, the same kind of negative events. But couples that stay married have 5 positive events to every 1 negative event in their marriage, whereas in unhappily married and ultimately divorced couples, the ratio is more like 1 to 1. For everything bad that happens, 1 good thing happens, but over time, it's not enough positivity. And so it was interesting that our ratios really reflected what we see in other literatures, that it's about 5 positive events for every 1 negative event tend to be resilient. And when you get closer to that 1 to 1 ratio of, I had a fun moment with my brother and then my brother punched me, and I kind of have these equal levels of frustration and delight, that actually is predictive of having a more traumatic symptoms later. Okay, slide.
And actually, and Lara, so
Yes.
it is now 7:10. So we
Okay.
have 20 minutes left before the session is complete, but we do need the 10 minutes left at the end. So you have about 10 minutes left, okay?
That is great. The other, I'll just kind of hit a couple high points, and Jane and Emma, you can advance my slides pretty quick. If you look at resilience scores, our kids had lower resilience. So 30 is the average score for American youth, and in our study, it was 25. So I think just recognizing that even if kids are doing okay in the minute, they're going into life challenges with fewer kind of resources or less resilience in their pocket. So it may be that some peer challenge in school that has nothing to do with the family, they just have fewer resources to manage it. So less resilience. We found that the higher the parent well-being, the higher the sibling well-being. So mom and dad, when you're taking care of, parents get this all the time. Take care of yourself, put your own oxygen mask on first, and then take care of your children. Engage in self-care. And I think often parents will say, yeah, yada, yada, that sounds nice, but my kid needs me right now. But we found that when the parents were in a better place, not only did that help the child with the disability, it helped the healthy siblings as well. So 30% of our siblings reported that they don't have friends over to their house anymore, primarily because they were either helping take care of their child with a disability or they felt like friends couldn't empathize. So again, it's one way in which resources are kind of depleted from the healthy sibling compared to families where there's not a child with a disability. We saw extremely high rates of PTSD symptoms in our group. We had about 60% reporting nightmares and flashbacks or avoidance, like I just don't want to go home because I don't want to know what happened today, or just a sense of hypervigilance and being on edge. Like, are they going to have a tantrum now? You know, how hard is this next thing going to be? So growing up in this setting of having multiple traumatic symptoms. Slide. That said, again, it's a complex emotional picture. On average, when we ask kids, how much do you like being a sibling to a child with PotterWillie, the average rating was over 7 out of 10. We gave them 0, I hate it, to 10, I love it. It's a great thing. I would choose this. Most of our siblings, when at the end of the day, are like, I really like being a sibling to a child with a disability. So I'll put back to you guys for kind of the takeaway messages we've gotten from both our studies and feedback from families.
Yeah, so the take-home message is basically just being aware of this, that siblings are impacted is huge, but there are like concrete things that you can do that potentially will improve sibling well-being and resilience. And I think this is on our resource sheet, so you should have this information. But communication is big. Just talking. A lot of times, like Lara said, like siblings don't want to burden their parents, but so parents need to ask the siblings what's going on.
So some communication tips that can help facilitate those. It's often difficult communication. So initiate the conversations with siblings, like Jane mentioned, schedule times perhaps to talk, continually check in with them and listen to what they're saying. This can be difficult because of judgment. Jane, do you want to finish?
Yeah, so never invalidate what your child.
It seems like the connection was lost.
We might have lost the girls for a minute. Do you want to give them 1 minute to see if they just log right back in? Or Lara, did you have a copy of that presentation?
I'm gonna pull it up right now. So I think one of the things that we found, because life happens, right? And again, I have 4 kids, I get it. You come home from work, you're trying to touch base with everyone. We tend to respond to the crisis that's in front of us or the challenge that's in front of us for any given day. So we just thought parents and kids were telling us it's really important to just consciously and mindfully make time. Let me see. So I have the slides up. Do I share it or do you share it?
Would you like to attempt sharing it?
Yeah, go. Can you make my screen shared? Or do I do that?
You should be able to share it with the green share screen at the bottom.
Okay, let me just see. Got it. Okay.
And Jane is back on.
Okay.
Yeah, our bad, sorry.
Can you guys see my slides?
Yeah. Yes, perfect.
Okay.
And we were just about done.
So let's see. So listening to what kids say, and like Jane was saying, really validating it. And it's okay to be angry. It doesn't mean they hate their sibling. It doesn't mean that anger is going to last forever. It's okay to be frustrated. It's okay to be sad. It's okay to be embarrassed. Like we all have those moments, and letting the children express that, validate, yeah, I get that that's real, and you're doing really well. And then create that environment for open sharing. Again, you know, I think we often as parents kind of parent from the person who needs us most at the moment. And so it kind of becomes our habit to take care of the child with a disability sometimes first. And the very real reality is that our time with our healthy siblings may be limited. So making sure that we find that time, like this is me and mom night, you know, like where we're going to get away without our, just have time. It's like couple time, right? But only with your kids. Some other things families were sharing with us and our siblings were saying is like sometimes, not always, but sometimes it's nice to have a vacation without the child of disability so that, you know, you can go on the crazy ride without scaring the sibling, or Other families said, again, this regular time, individually and together, and finding respite care. I mean, one of the things we hear all the time, or I hear all the time, is like, no one knows my child with a disability like I do, and my partner does, and my children do, right? No one else gets it in the way our family does. That is true. And the child with a disability needs to know there are people in the world that can take care of them. And the healthy siblings sometimes need a break from caring and need to know they can just have mom and dad, and their sibling with a disability can be safe with someone else for a while. Creating humor, kind of laugh. Sometimes we can't laugh at the minute, but laughing later about, oh my gosh, how silly must we have looked, or how scary was that, or practicing mindfulness, building in positive experiences planfully and mindfully, and then finding professional help as soon as you recognize someone in your family is kind of in over their heads. I'll just share one fun story we had from the sibling support groups. Is a boy was talking about, he was taking care of his brother was not listening and kind of having a tantrum and melting down, and the brother with a disability was insisting, like, call mom, talk to mom. And the brother didn't want to disrupt parents' date night, so he picked up the TV remote and pretended to call. And I think 2/3 of our group has been like, I did that. And like, they all started laughing about, tricking their sibling by pretending to call on a remote. And again, it's something that families maybe outside these systems don't get, but they really got, and it was really important to share and laugh about that. If a child has aggression or periods of violence or those kinds of things, it really is important after everyone's safe to have kind of a critical incident debriefing, and typically without the child with the disability. So this is more true maybe in PotterWillie or some of our kids with autism who have more behavioral comorbidities. But just sitting down and being like, wow, that was hard, checking in with everyone, letting everyone reflect, to build that sense of we're a team and we're in this together. And what we just went through was hard, but we can build our cohesion. We can diffuse these intense emotions by talking about them. We can talk about, you know what, I know you meant well when you jumped in, but sometimes it's more helpful for me if you step out and let me handle it. Or I was overwhelmed. I need to be able to step out and have you step in, and kind of let the sibling be part of the solution and part of the problem solving. So here's some tips that we include in our sheets and our handouts about what you can do, again, about finding humor, letting it flow. You don't have to solve problems. I think as parents, we want to solve problems. Sometimes we just need to name it to tame it, right? We just need to be present with it. In terms of family organization, what our quantitative data showed was that being organized is actually a protective factor. So having schedules, having routines, having doctor's appointments, knowing who's doing what, that's protective. However, when we get into like a rigid stance and are very strict or very controlling, like I need it exactly like this or we can't flex, that's a risk factor. So finding that sweet spot where you're organized but not too rigidly controlling. Again, we know with kids with disabilities and just parenting in general, we have to have some flexibility to respond to what's in front of us. Most of our children reported that they did not enjoy taking care of their child with a disability, that even though they understood the child better than maybe other adults, it felt overwhelming and it was scary and it was a lot of responsibility. So even though, again, we have big families often in Utah, most of our siblings are babysitting or tending frequently. It's often very, very challenging and hard to tell a parent, like, I can't do this. Let's see. So helping that triggering sibling is, because again, I think as a parent, we can be like, oh, why did you do that? You know, they hate that. Recognizing all behavior has a function. We get that typically, like through ABA therapy, we talk about that for the child with a disability. The healthy children's behavior has a function too. And so pausing, trying to understand what just happened, normalizing it, and being like, and educating the child, and then trying to help substitute with healthy coping. Again, monitor how much some of our kind of miniature parents, sweetheart kids want to jump in there and to help us, but monitor and be explicit about giving siblings breaks. Don't assume they're okay because they look okay. A lot of our healthy siblings look like rock stars. They're great students, they're great athletes, they have all these positive things, but inside they're struggling. So check in on our siblings.
Lara?
Yeah.
Okay.
Okay. So I think that was really kind of our take-home message. We just need to check in often, hang together, and give siblings a place where they can talk about their lives.